today's video, we'd like to continue on the PCOS stage to talk about the most common traditional method for the PCOS, which is the ovarian drilling technique. So before we go into the comparison between ovarian drilling and treatment that we offer here at Anti-Hospital, would like to discuss the PCOS, cause behind it, and the symptoms. So as we all know in the previously in our videos, we discussed so many times the PCOS is caused by this abnormal testicular tissue that we have the remain during embryogenesis fused together with the ovarian caused by women who develop the PCOS to have high levels in testosterone is because within this patient with the ovaries there are trace amount of testicular tissue where areas this the normal counterparts will not have it to problem. There are no testicular tissue that we secrete the testosterone, and the symptoms that are associated with the PCOS are the excessive acne, face and body, how it's affect your insulin insensitivity, causing obesity, and then it can be also excessive body hair, and then it may also lead to the infertility. And then the most common symptom is that your menses is not infrequent, it not regular. We usually we want to see the 1 month once, but this the patient they only evaluate every 2 to 3 months. Sometimes the patient have a much more severe symptoms where they only evaluate once or twice a year. So these things that we identify that closely linked to the PCOS. So the common treatment in conventional hospital that they offer you is firstly they will give you the oral contraceptive pills to actually ease the symptom. It does not to treat your underlying cause, just to allow the symptoms of the acne, the skin problem, and the hair, the obesity at all of this. That but if they doesn't work, they will recommend you the ovarian drillings technique. This technique is used to is laparoscopic surgery, whereas the will that carefully drill holes the ovaries, remove this abnormal tissue. They usually remove the large amount of ovarian tissue that we want to remain and being removed as well. And because they do not severe abnormal tissue and can lead to other complications, for example, the ovaries becoming smaller, volume of, and then the size affecting your future evolution, and also can lead to premature. It can lead to premature ovarian insufficiency as well, leading to the symptoms such as very similar to menopause. Some symptom that you might encounter during your menopause, you will encounter them much earlier because of this surgery. So here at Anti-Hospital, we do similar treatment. However, the cadence thing, the difference between traditional method and our treatment here is that we want to differentiate